Hi, this is Dr. Jonathan Spages, and I'm excited to give you a 4-part series about how to go about reversing diabetes. So this is going to be very educational, and it's probably going to be a lot of fun, but you'd be surprised over the last 20 years how many people don't actually understand really what diabetes is and also what to do about reversing it. Everybody knows about the basic things like treating it as well as the diets and the things that they provide, but there's actually a lot of information. So on the first video, what we're about to go over is I'm actually going to give you the 15 most common questions people ask me. These are the ones I've been hearing from diabetics throughout the last 20 years. And I'm going to kind of answer it in maybe a way that you're not familiar with. So buckle up. If you have a piece of paper and pen, a good time to grab it, but a lot of information. I'm really excited to go over this information with you. So each series of videos, you're going to learn more and more. All right, so let's get started.
The 15 most common questions about reversing type 2 diabetes. What is type 2 diabetes?
So what type 2 diabetes is a metabolic disease. Now, there are many components to it, but I will tell you what's a little different about what you may be familiar with versus what I've seen over the last 20 years. So the first thing we look at is what they tell doctors, nurses, maybe what you've Googled or saw online, is that diabetes is a pancreatic issue where you have insulin resistance. And there's some truth to that kind of. And what insulin resistance means is essentially is if you have a cell of your body, you want to be able to get the sugar into the cell. And as a person has insulin resistance, they don't have that ability. They can't get into the cell. And what happens is as someone checks their blood sugar level, their blood sugar levels are high, and thus it can cause a lot of problems. That sugar doesn't belong in our body circulating, so that's actually a problem. Now, from a functional medicine side of it, it's a little different because what I look for is kind of the root cause of what's causing a person's blood sugar level coming up. So with that being said, there are actually 4 organs that actually control blood sugar. And that's not only the pancreas, right? Because we hear pancreas, 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 but truth be told, there's actually other things that do affect it. Pancreas is a part of it. You also have your liver, your thyroid, and your adrenal glands. So essentially, in order to be a type 2 diabetic, one or more of those organs have to be dysfunctional. Sometimes for patients, it's the liver. Actually, let me rephrase that. I've never seen a proper functioning liver in a type 2 diabetic, but let's just say it could be the liver, it could be the thyroid, and it could be the adrenal glands, a part of the pancreas. Believe it or not, after doing this thousands of times, I don't tend to see the pancreas being an issue, meaning that your pancreas is probably working really good. So that's what they tell you, but I'm going to tell you the reality of it in terms of reversing diabetes is that the pancreas usually works fine. Okay, so there you go. So type 2 diabetes is a metabolic disease. All right, there you go.
What do you say causes type 2 diabetes?
So, what causes diabetes is actually pretty interesting. I'm going to make it real simple when we look at it from a causative point of view, which is very different than how most people understand diabetes and other health chronic issues. Do that. So I'm going to give you from a different point of view of what I have seen related to type 2 diabetes. For most of the patients that I meet, there was a point in time where their body was actually functioning really good, right? Everything was working. They weren't worried about being a diabetic or having cholesterol problems or blood pressure problems. And maybe their weight wasn't an issue. And then at some point in time, what we find is that the body can no longer stay balanced. And what does that mean? Well, basically, if there is any stresses from chemical stress, food stress, financial stress, whatever stress, the body can usually adapt pretty well. But there is that point in time where the body no longer adapts. And that is the point where you start getting the body dysfunctioning, right? It's not perfect. So if we look at a car tire, maybe the car tire is not fully inflated. Maybe there's a little bit of air leaking. Maybe it's not flat yet, right? But there's something wrong with the tire. And essentially, the way our healthcare system works, which is I'm laughing out of disbelief, is that they allow someone to continue to get worse and worse and worse and worse, and then eventually they need a medication, right? Cholesterol med, blood pressure med, diabetic med, and then it gets worse and worse and worse. And that person is sitting there thinking that they got to diet and exercise their way to get back to balance. And truth be told, we're going to get into that in other videos here, but truth be told is usually it doesn't fix in getting the body back to balance. But anyway, what causes diabetes is basically your body becoming dysfunctional. The body goes out of balance and nothing is being done to put it back to balance. So for instance, if we look at like a diet, well, if the person's liver is not doing well, you can't diet your way to fixing that, right? If the person's adrenal glands aren't functioning, there's no diet for that. You have to go there and actually get that body back in balance. Obviously in my office, I do that naturally, but you don't just go there and just eat more celery or I don't know, some healthy food and get the adrenal glands working and so forth. So the combo that really sits in well with people reversing diabetes is a mixture of diet and also supplements. So it's not just diet alone, and it's not just supplements, and we'll talk about that in a later video. But anyway, when we look at the causes of type 2 diabetes, it is the body dysfunctional. Maybe it's one of these glands and organs I just talked about. Sometimes I see diabetics who have infections that are just sitting in the body that aren't being addressed. So that is essentially what causes blood sugar level to go up. That's also what causes weight issues, right? That's also a very common thing that causes weight issues, as well as other health problems and energy, right? So a lot of times in our society, unfortunately, we play the age card. I'm getting older, blah, 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 right? We're all familiar with this. But that's not necessarily true, because we know people who are in their 90s who are bursting with energy. And I'm sure we all know someone in our 30s and 40s who are young who don't have any energy, right? So it's not only an age thing, it's more of a function. So the body's got to function correctly.
How is type 2 diabetes diagnosed?
You know, there's a couple of ways of actually diagnosing diabetes. It's not tremendously hard. So there are a couple of things. First off, you can obviously get a blood test done. It is clinically obvious in blood tests where something called an A1C, when it gets over 6.4, that is when a person gets a label of being a type 2 diabetic, so if they're 6.5 or higher. And then also when we look at blood sugar levels, anything over 126. It's kind of crazy though, from a functional medicine point of view, that we allow someone to get to that point. So you may have heard of a phrase called pre-diabetes. And in pre-diabetes, there's really no such thing. It's either your body is functioning well or it's not. So the way our healthcare system thinks of this is that, you know, someone whose blood sugar level is starting to go over 5.7 for their A1C and their blood glucose that's going over 100, you know, they're kind of like, well, you know, you're sick, but you're not super sick. And we'll just wait till you get really, really sick and then we'll start giving you a medication. I think that's kind of crazy. That's not how I practice or whatever, like someone to practice on me. I don't want to wait till someone gets, or I get to a point where I'm really, really sick. I'd rather have it where if it's starting to become dysfunctional, like let's nip this thing in the bud and address it right then and there, as opposed to letting it get worse and worse. So there's really no such thing as pre-diabetes. Either you have healthy blood sugar or you don't, right? It's one or the other, right? You can't just have both. So it's a matter of your body functioning, right? You want to function really, really good.
So, what are normal sugar numbers for a healthy person?
You know, this is a great question. So normal sugar levels, fasting, right? So this means you haven't eaten after, 6 to 8 hours, is anywhere between 85 to 99. So the way I like to educate patients is kind of like the temperature of a shower. So if you went into a shower or even a hot tub legally cannot be over 104 degrees. But if you went into a hot tub shower, that's about a good temperature. And that's kind of the easy way to think about what blood sugar level should be. So, sometimes I meet a diabetic and their blood sugar levels are in the 130s, 150s, even higher. And it would be like them walking into a shower at like 130 degrees or 150 degrees. It's that their body's burning up inside, right? Diabetes is an inflammatory disease. And you're seeing how much destruction is happening because of this disease process. So it's really important that a person who is healthy has blood sugar level between 85 and 99, and then also their A1C is under 5.7.
What are the available treatment options for type 2 diabetics?
So typically, when someone in our country gets diagnosed as a type 2 diabetic, usually it's the same scenario, right? Which I hear from patients all the time. It's change the diet, go exercise, go lose some weight, and then also here's a medication. Now, when I first started doing this over 20 years ago, there was probably like 15 medications. Now there's more and more medication. And what these things, medications and strategy is doing is trying to control the numbers. Now, first off, that's a really good thing, right? I'm not anti-medicine. I think that's a really good thing. But for me, I'm always looking at, in functional medicine, what's causing the numbers to go up. Because here's the deal. If we see that there's smoke, but we don't figure out where the fire is, then you're basically just stuck there, keep on treating the smoke and the smoke. And this can be done, I've seen on both sides. I've seen it done where it's done with medication, right? If someone's taking medication. But also I see and meet sometimes someone who's doing natural things. They're starting to take different supplements to hold the numbers down. And that's not necessarily a bad thing, because you don't want your blood sugar levels to be high, and obviously you don't want to get worse as a diabetic. But in the same light, you want to go and make sure, as you're trying to hold the numbers down, you're also putting out where that fire is. You can't do one or the other. You should do both. And that's where I see patients do the best, right? They're in my office, they're taking their pharmaceutical medications that their doctor recommends. And then on the same light, they're going and actually putting out these fires that I find within labs and testing them to figure out what specific fires they have. Is it a fire here? Is it a fire there? And then obviously showing them what to do to put out those fires. So it's really one or the other, right? Now, most people think also, what are the treatment options related to your diet? Now, we're going to get into diet, obviously. I know it's one of the questions you have, but the question really we look at is like, diet has a different strategy to it, which I'll go into it. So the diet needs to just be basically a healthy diet, nothing too fancy.
What is the best way to test your sugar numbers?
There's a couple different ways of checking your blood sugar levels. So I'll give you what I think is the best. The best, most accurate way of actually checking blood sugar is actually a blood test, right? Going and getting a blood draw where they're having a larger supply of blood that we can look at to be able to see that. And you can get that done through a doctor, a nurse, or even in my office, we run tests every single day. So that's really the most accurate. Then from there, believe it or not, that good old glucometer, where it's that meter you put on the side of your finger. That, believe it or not, is actually pretty good. And now the new technology is the CGMs, the continuous glucose monitors. They tend to be off. Now, if someone is going to use a device like that, it's good to do it if they are able to calibrate it. So a lot of these devices, when they come out, they're not calibrated, and you could check your blood sugar on the glucometer. It could be 30 points off on the continuous glucose monitor. So it's a little bit alarming, as it shows a higher number. So I always recommend calibrating it so you could see exactly what the actual number is. And one of the things that I do like about a continuous glucose monitor is that it could tell you if you're spiking. So for instance, like if you're eating the wrong food, it could actually show you that, hey, listen, you just ate a particular food and all of a sudden your blood sugar level went up 100 points. Well, great, not to eat that food. Your body can't handle it at that time. So I like it for that reason. Now, you could still do this with a glucometer. You would just have to prick your finger after, obviously, you eat. Okay, so some people don't like doing that. So anyway, those are the three options. Blood draw, number one. Number two is glucometer. And then lastly, CGM. All right, very good.
A controversial solution that diabetics hear is that it is genetic. So is diabetes genetic?
I did a blog on this, and I go into great detail about it. The long and short of it is no. There's no gene for type 2 diabetes. Type 2 diabetes is not a genetic disease. So we know this because they did a big, huge, what's called genome project. And we as taxpayers spent a lot of money, right? Millions and millions of dollars to study all the different DNA things to look at genes. And they did not find the gene for type 2 diabetes, right? And we know this to be factual as well, because that study was done a long time ago, and it's not like they're doing gene therapy to reverse type 2 diabetes. So no, is not mom or dad's thing. It's something that you probably have inherited based on what I said earlier, right? Your body was working right, at some point really good, and then life shows up and things go out of balance and it doesn't adjust back, and then, here you go and you're dependent on medication, right? So, yeah, that's usually how I see it occur.
Here's a common question. How do I improve my sugar numbers?
I get this question often, and there's a number of things to do to improve blood sugar levels. I'm going to give you the real simple answer, and then I'll make it more complex, just because I want to be thorough on this particular question. So the simplest way, right, is if you're doing really bad things in your diet, right, you're doing something that's adding gasoline to the fire that I just mentioned earlier in earlier questions. Then obviously stop that. You don't want to go there and add gasoline to the fire. So if you're eating bad food, you're drinking alcohol, you're doing like sugary drinks, well, all you're doing is adding gasoline to something that's already bad. So that's number one. You could certainly do that. Now, a lot of patients are told to exercise. Now, I'm not a fan of exercising long term, which we'll talk about in another module, but the thing we have to look at is that is something that could be done, because as you are exercising, it could help lessen the sugar in your bloodstream, right? That is possible. Not a good long-term solution, but anyway, it is a possibility. And then lastly, you can certainly treat the numbers, right? I talk about this in another question, where, you can go and, put some, medication into the mix. You could add some supplements, and that will help force the numbers down. And that's probably a quicker way of doing it. So the three things I just mentioned are fast, kind of quick fixes. I don't like quick fixes, because what happens is you're not going to wind up getting a long-term result. Yeah, you can quickly get your blood sugar levels down, kind of whippy, but that's not really what's going to get someone to be healthy, right? You don't want someone also to have a mindset as a type 2 diabetic as like, hey, I want to be really bad, but also be healthy. And patients in my office, they think differently. They think, hey, listen, I want to invest in myself, invest in my health, so I can stay well and be well long-term, and not just put a Band-Aid on every single thing that pops up. And I think that approach is always the best approach. So the way to really get blood sugar levels better is you have to find what's causing your blood sugar levels to go up, and then fix it, right? And then finally leave it alone. So that has been the long-term solution. That is what my practice is geared around, where I'm finding what the actual fires are individual to somebody who's a diabetic. And believe it or not, most of the times it's not diet, believe it or not. So I find those fires, and then using diet strategies as well as specific supplement protocols, we start putting out those fires kind of layer by layer. And that is how someone just reverses their diabetes, and why we have such a high success rate of doing that is we're getting down to the root of it. That's really what it comes down to.
Can type 2 diabetes be reversed?
Of course it can. I've been doing it for 20 years, tens of thousands of patients. Yeah, it can definitely be reversed. And it's interesting because even back in like the 80s, right? Like when Michael Jackson was a thing, right? 80s, everybody remembers the 80s. Yeah, there was studies published in medical journals that diabetes can go in remission. And what essentially it means is that if the A1C can be at a low range for, like 60 days, they consider that person who no longer having diabetes. Now, I've had patients for years, right? For years and years and years, no longer have high A1Cs, and obviously their blood sugar levels are normal. So you could absolutely reverse type 2 diabetes. Even the American Diabetic Association says it's possible. They don't obviously show you how, but nevertheless, yeah, you reverse type 2 diabetes. Great question.
Someone asked, will I need medications for the rest of my life?
That's a great question. Everybody is different. The majority of the patients that I work with one-on-one, where I'm showing them how to put out the fires, me and my staff, they're able to stay off medication usually for the rest of their life, as long as they're doing things that aren't beating themselves up. So for instance, let's say if they have a high stress job and their adrenal glands can't function well, if they can manage that with making sure they follow the diet I give them. Also, if they're, making sure that they're adjusting it with supplements, right? Their body needs some supplements to handle that stress. Yeah, usually their blood sugar levels can stay down. Sometimes we'll see someone who they live in a different part of the world, and they wind up getting an infection from drinking bad water in the stream or something. And we would encourage them not to go back and go into a stream that may have parasites and God knows what, right? So just for a lot of good reasons. But anyway, those sort of things. But the amazing part about it, even with that being said, is that if someone starts deviating off and they're starting putting, gasoline back on the fires that they put out, it's not hard to get them back on course, right? I could run simple labs. I could look for certain things that get them back on course. I don't like doing that because I want them to stay well, but if we have a kind of a fail-safe, right? So if things do get out of whack, maybe the thyroid gets stressed, the adrenal glands or the liver or something, like patients in my office always go through cleanses. Usually I recommend them do it once a year, where we detox the body and we get the liver working, since the liver is like your number one organ for reversing diabetes, metabolism, and weight, right? Like number one. Even myself, I wound up doing that as well. My liver is not really my stress point. My adrenal glands are. So raising 3 kids, having a busy practice, writing books, writing blogs, doing TV interviews, radio interviews, it gets a little stressful at times for sure. And my adrenal glands, I just wear them down. So I'm always working on them. I'm running labs. I'm seeing what's going on. And if I need to tighten a screw here or there, then obviously I do that. And obviously I take supplements on a regular basis. My diet genuinely is always good. If I do cheat, I cheat healthy, if that makes any sense. But I'm not at a place where I'm in like any sort of disease process. So sometimes I start seeing myself go a little bit like this. Great. I just put myself back like this, right? I don't want to get down here and be dependent on medication, right? So anyway, yeah, that's kind of an easy way to understand it. So if you're able to put out your fires and sustain that, then yeah, I can't see why you would need medication since your body is working correctly.
Interesting question. Can I have soda as a diabetic?
Really? Is that the question? Oh my God, that's funny. So can you have sodas? Sure, but you obviously don't want the sugar part of it, and it's probably better to get a healthier soda. One that's pretty common is a product called Zevia, and it's made with a natural sweetener. So that's a product that diabetics could have. But remember, soda alone, I mean, you need also a healthy diet, right? So just soda alone, but can't believe that's a popular question people want to know. Yeah, there's your answer.
Some diabetics hear that insulin and Ozempic are good. What is your opinion?
That's a interesting point about insulin and Ozempic. So Ozempic's the new, hot drug that's out right now. And let's talk about the purpose of them to understand if they're good or bad. So if someone's a type 2 diabetic, obviously there's a lot of smoke, right? Something is causing that smoke, right? I talk about it on other videos and so forth. It could be the liver, the pancreas, the adrenal glands, infections, autoimmune diseases, metabolic issues, the list goes on, right? There's something causing it is kind of the point I'm trying to make. So when we look at something like Ozempic and insulin, they're not really fixing what could be causing it. Now, insulin for some diabetics, it's saving their life, and thank God for that. But you got to also put out the fire, right? That's the key thing that I want to emphasize. And the thing that I see being a problem where most people struggle is that our healthcare system is not really set up to help patients put out fires. They're just more of like, treat the symptom, treat the symptom, treat the symptom, the cholesterol, the blood pressure, and so forth. But great, but you want to put out the fire. So that's why I like reversing diabetes, not treating the numbers, because you're treating the numbers, you're not really getting anywhere. All right.
What is the best diet for diabetics?
Very simple. It's a healthy diet, simply put. So, okay, let's talk about diet. All right. So the first big issue I see with diet, and I'll have another video on this topic, is most people are told as a type 2 diabetic that they need to diet and diet and diet and diet and diet. Sure. However, we all know somebody who is eating well, healthy, salads, lean meats, and they're still really sick. They still have blood pressure problems, they still have cholesterol problems, they still have diabetes. And then we know someone, right, we all do, who eats horrible. They eat all the wrong food, they drink alcohol, they smoke cigarettes, right? They are not the epitome of health. They're the opposite of that. And they're not a diabetic, right? And they're not struggling with weight. We're like almost upset with these particular people that actually have this issue where they eat all the wrong things and do all the wrong things, and yet they're not sick. So there has to be a strategy related to diet, right? And diet alone doesn't reverse diabetes. I know there's a lot of things out there. I know, my books, I even talk about some of that. But the diet alone is actually not the only answer, all right? And on another video, I'll get into diet. But yeah, the quick answer is you need a healthy diet, simply put, right? Meats, fruits, veggies, that's it. That's it.
Someone asked, can I ever eat carbs again?
Can I ever eat carbs again? Yes, you have to earn your carbs, meaning, if you're working hard enough on reversing your diabetes, putting out the fires, right? If you're in my office following what I tell you to do, then yeah, you could eventually have carbs again because your body can handle the carbs. We all know that there are people who eat tons of carbs every single day, pizzas, cookies, cakes, donuts, and they're not a diabetic. The point is they got their body back to balance where your body, if you're a type 2 diabetic, is out of balance. So yes, have I had many patients in the beginning of care in my office where they can't eat rice or bread or really anything that they enjoy, right? And then as they work on getting themselves better, they eat rice and bread and other things, and it doesn't affect their blood sugar. And it definitely doesn't have them in a situation where they're a diabetic dependent on medication, right? So it's a matter of making sure you're working on putting out the fires. And a lot of patients that I meet are diabetic, they've raised kids, they've lived their career, they're retiring, and they beat themselves up doing that, right? Working late nights. I know moms are notorious for this, but you want to make sure the body is actually functioning well. All right. So answer that question.
How can I prevent ever being a diabetic?
I would say eat healthy, live healthy, definitely take the basic supplements that you should be taking, the vitamin Ds, the omegas, things like that. Those are the basic fundamentals of being well. Obviously, limiting junk food, limiting processed foods, eliminating foods that could be inflammatory, that could help someone prevent obviously being a type 2 diabetic. And the reason why that does it is very important. It's because some of these things that I just mentioned, they stress the body, right? So if they're stressing the body, there is that that breaking point where the body can no longer adjust itself. And this is where a lack of harmony, function occurs. And that's where, like in my office, I look for that specifically for somebody, obviously. But what's really important is to prevent it. You want to be healthy, right? Once you get to that point of your body is having a really hard time doing it, even if you're dieting and trying to do things to improve your quality of life, that is where I recommend going to somebody like myself who goes and runs labs to really look under the hood, figure out where the heck the fires are, and then go and work on putting those fires out. But I'll tell you, trying to figure it out through diet and that sort of thing is next to impossible because it's not answering how you got there in the first place. The diet is just literally the basics of what's happening. All right. So anyway, that is how you prevent type 2 diabetes.
Rapid fire. How many types of diabetes exist?
How many types of diabetes are there? Okay, rapid fire. Okay, let me think. So there are 4 types of diabetes. Number 1 is autoimmune, right? That is where your pancreas doesn't work. Your pancreas genetically isn't there. Number 2 is insulin resistant, which most diabetics are. Number 3 is neurodegenerative, where things like dementia, things of that nature. And then 1.5, the hardest diabetic, is where you have an autoimmune and also diabetes. I see a lot of these, most challenging cases. Boy, that was quick. Yeah, those are the 4 types of diabetes. All right, so I hope you like those questions that I just answered. On the next video, we're actually going to be talking about how to reverse type 2 diabetes. So check that out.